Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Let's introduce myself before. My name is Alan Rafifa with student ID number 2010701016 from Accounting Study Program, Asia Yogyakarta University. Today, I will tell about the COVID-19 pandemic which is still ongoing today. And the topic I will take is about the importance of using masks when we are outside house and meet strangers. So I made this video for my final semester exams assignment in the English for Academic Conversation course. As we know, the COVID-19 pandemic has reshaped life. Many of us are staying at home, avoiding people on the street, and changing daily habits like going to school or work in ways we never imagined before. While we are changing old behaviors, there are new routines we need to adopt. And the important first and foremost is the habit of wearing masks or face covering whenever we are in a public space. Based on our prior work in outbreaks of infection disease, we know that the clear, consistent message about what people can do to protect themselves and their community are so critical. By that measure, the messaging on masks has been confusing. Early in the pandemic, the general public was told not to wear masks. This was driven by the long-standing recognition that standard surgical masks, also called medical masks, are insufficient to protect the wearer from many respiratory pathogens. As we all ask the concern about diverting limited supplies from healthcare settings, science is the pursuit of knowledge and understanding, and it inevitably changes the way we see the world. Thanks to the tireless efforts of scientists everywhere, we have compressed years of research on the COVID-19 virus into one. This has led to a rapid evaluation of policies and recommendations, and not surprisingly, some skeptics about the advice of experts. These are some of the things we've learned. Masks and face coverings can prevent the wearer from transmitting the COVID-19 virus to others and may provide some protection to the wearer. Multiple studies have shown that face coverings can contain droplets expelled from the wearer, which are responsible for the majority of transmission of the virus. This surge control approach reflects a shift in thinking from a medical perspective. Will it protect the wearer? To a public health perspective, will it help reduce community transmission and risk for everyone? Many people with COVID-19 are unaware they are carrying the virus. It's estimated that 40% of persons with COVID-19 are asymptomatic but potentially able to transmit the virus to others. In the absence of screening tests, we have no way of identifying many people who are silently transmitting the virus in their community. Universal mask use can significantly reduce virus transmission in the community by preventing anyone, including those who are unwittingly carrying the virus, from transmitting it to others. Disease modeling suggests masks worn by significant portion of the population, coupled with other measures, could result in substantial reduction in case number and death. Masks are not perfect barriers to transmission, but they don't need to be perfect if they are not used alone. Universal mask use should be accompanied by other public health measures such as physical distancing, testing, contact tracing, and restriction on large gathering. Those measures are perfect either, but when many imperfect measures are combined at the community level, they can be very effective at slowing transmission and reducing infection. And then masks can also reduce the equitable impact of the pandemic, particularly for those who live in crowded environments where physical distancing is difficult, and for those who work in frontline roles where there is a greater risk of exposure to the virus. Wearing a mask isn't a restriction of our freedom. Rather, it helps us to regain freedom by reducing virus transmission in a community and making every interaction safer. Freedom for people to go to work, attend school, interact with others, and most importantly, freedom for illness and fear. And for me, the best solution for the pandemic is a safe and effective vaccine, and the biopharmaceutical industry is working closely with government, regulators, the scientific community, and non-governmental organizations to develop vaccines at unprecedented speed. but unfortunately, vaccines are unlikely to be available to most of the world for some time, and we need a way to protect communities and keep society functioning in the meantime. In combination with other measures, universal masks use could help drive virus transmission down to level we expect to ease after vaccine become available. While we live in a globalist world, it is alright that nearly everyone on the planet needs to adopt a common behavior at the same time. In the words of Dr. Ngozi Okonjo-Iweala, board chairs of Gavi, no one will be safe until everyone is safe. The time to act is now, and the way to act is together. Therefore, let's take care of ourselves, take care of our health, wear masks with our hands when we want to do activities, and keep our distance from other people. Because if we all don't want to work together to handle COVID-19, then the pandemic will last longer. I hope the world recovers quickly and the pandemic ends, and we can return to normal activities as usual. Thank you for attention, and that's all for my story about COVID-19 is the importance of using masks. See you on the next video. Assalamualaikum warahmatullahi wabarakatuh.